Good morning, my name is Jackline Padilla. I'm a student at St. Thomas University. I will be performing a physical assessment for my advanced health assessment class. Okay. Skin is normal for ethnicity. Head is midline, symmetrical. Skin is warm to touch. Skin turgor. No tenderness noted. There is no edema, swelling, or bruises. I'm gonna go ahead and feel your head. There's no lesion or masses noted. Hair is silver in color. I'm gonna go ahead and palpate your temporal arteries. Okay. I'm gonna go ahead and listen to them. I'm gonna check for any bruit. No bruit noted. I'm gonna go ahead and feel for your periauricular lymph node, post-auricular lymph node, post-occipital lymph node, anterior lymph node, anterior cervical lymph node, correction, posterior cervical lymph node, submental lymph node, submandibular lymph node, and supraclavicular lymph node. Okay, no swelling noted. I'm gonna go ahead and have you clench your jaw. Okay, I'm just checking here for cranial nerve number 5. Okay, I'm gonna go ahead and inspect your facial symmetry. So I'm gonna have you raise your eyebrows up and down. Smile for me. Okay. Puff your cheeks. Okay. Cranial nerve number 7 intact. I'm gonna go ahead and inspect your ear. If I had an otoscope, I would be looking in her ear, looking for the tympanic membrane, if it's reddened or swollen. The outer shape of the ear is normal. There's no swelling noted, no redness. I'm gonna go ahead and palpate the pinnae and tragus for masses and tenderness. Okay, so massive tenderness noted. Okay, gonna go ahead and inspect her eye. There's no drainage noted. Her sclera is white. Lashes are intact. Brows are intact. Okay, I'm gonna go ahead and assess your cranial number 2. So I'm gonna be assessing for acuity and peripheral central vision. Okay, so I'm gonna have you look straight at me, and I'm gonna have you tell me when you see my finger.
No.
Okay, how about now?
No.
Okay, alright, perfect. Cranial nerve 2 intact. If I had a pen light, I would be checking for cranial number 2, which tests for pupillary response to the light and accommodation. Okay, if I had an ophthalmoscope, I would be checking for reflexes of the internal eye and any other structure of the eye, such as red reflexes and accessory structures. Okay, I'm gonna go ahead and inspect your nose. Your nose is midline, same color as skin. I'm gonna go ahead and palpate for your frontal sinuses and maxillary sinuses. Okay. I'm gonna go ahead and inspect your throat and mouth. Inspect lips. Lips are fine. They're pink. Okay. I'm gonna go ahead and have you open your mouth. Okay. Okay. uvula is red, midline, tonsils, there's no exudate noted. Teeth are white with yellow stain, missing teeth noted. I'm gonna go ahead and palpate, check for TMG. Open and close your jaw. Okay. No crepitus or swelling noted. Tongue, open your mouth again. Tongue is midline. Tongue is midline and symmetrical. There's no swelling noted. Okay. I'm going to go ahead and inspect your neck. Okay. Color is normal for ethnicity. Temperature is warm. There's no bruises or mass or lesion noted. I'm going to go ahead and palpate your thyroid gland. There's no swelling noted. Throat is midline. I'm going to go ahead and check for your carotid. Okay. I'm going to go ahead and listen to your carotid for any bruit. No bruit noted. I'm going to go ahead and test your range of motion. So I'm going to have you look that way. Okay, look this way. Okay, extend your head back. Okay, forward. Okay, I'm going to go ahead and have you shrug your shoulders. Okay, up and down one more time. Okay, cranial nerve number 11 is intact. Flexion is normal. Extension, hypertension, and lateral flexion and rotation of the head is normal. I'm going to go ahead and have you shrug your shoulder against resistance. Okay. Okay. Cranial nerve number 11 is intact. I'm going to go ahead and inspect your posterior chest. I'm just going to go ahead and lift this up a little bit. Posterior chest is intact. There is no bruising or discoloration noted. There's no masses or lesion noted. There's no signs of respiratory distress, no accessory muscles usage. 12 to 20 beats per breathing per minute. There's no flaring of the nose. Chest is anterior and posterior symmetrical, about 1 to 2 centimeter. There's no barrel chest noted. Okay, I'm gonna go ahead and listen to your lung sounds. Okay, lungs are clear, no adventitious sounds noted. Interior chest, there's no masses noted, there's no lesion, color is within normal limits for ethnicity. Okay. I'm going to go ahead and listen to your heart here. I'm going to go ahead and listen to the aortic valve, pulmonic, Erb's point, tricuspid, and the mitral valve, which is the point of maximal impulsion. Okay. Alright, I'm gonna go ahead and ask you to take your active pulse for 1 minute. Heart rate is regular, 75 beats per minute. Okay. I'm gonna have you lay down because I'm gonna inspect your abdomen. So if you don't mind. Okay. Alright, I'm inspecting her abdomen. Her abdomen is rounded in shape. I'm gonna go ahead and lift this up a little bit. Rounded in shape. Skin color is normal. It's warm to touch. There's no bruises, lesion, or masses noted. Okay. I'm gonna go ahead and ask you to for your aorta artery. Renal artery. Femoral arteries. And iliac arteries. Okay, I'm gonna go ahead and listen to your bowel sounds. Okay, bowel sounds are hyperactive. I'm gonna go ahead and check for the liver. Okay. There's no masses noted on the liver or tenderness. I'm gonna go ahead and check for your kidneys back here. Does anything here hurt?
No.
Okay, no tenderness noted in her kidneys. Okay, I'm gonna go have you sit up for me. Okay, I'm gonna go ahead and check your radial pulses. Okay, I'm gonna go ahead and check your brachial pulses. Okay, I'm gonna go ahead and check for capillary refills of the fingers. Okay, less than 3 seconds. Nails are intact. Hands are, there's no edema or redness or swelling noted. Skin is normal and warm to touch. Okay, I'm gonna have you flex your fingers like this. Okay. Alright, I'm gonna have you bend your wrist like this and up like that. Okay. Perfect. Now I'm gonna have you do some thumb up position. Go like this. Okay, good. Normal. Okay, I'm gonna check your elbows. There's no redness or swelling. There's no scars, bruises, or lesions noted on her elbow. Okay, I'm gonna test your hand grips. I'm gonna have you as tight as you can. Okay, hand grips normal. Okay, I'm gonna have you extend your arm like this, okay, and then like this. Okay, elbows are, you can put your hands down, okay. Flexion and extension, hyper extension, okay, down, normal, okay, I'm gonna have you flex for me against resistant, and I'm just testing your biceps and triceps. Okay, pretty strong there on both. Okay, I'm gonna go ahead and check your shoulders for any redness or swelling. Okay, there's no redness or swelling noted on her shoulders. Okay, I'm gonna have you go like this. Okay, range of motion of shoulder is intact. No deformity, tenderness. Okay. Alright. So if I had cross your legs, a hammer, I would be checking for her reflex on her knees. And here, here, and also here, and here. I would also be checking for Achilles reflexes and Babinski reflexes. I'm gonna go ahead and inspect your toes. Yes. Okay. Toes are intact. There's no scabs, open cuts, or redness noted. Capillary refill less than 3 seconds. Okay. Okay. I'm gonna have you flex your toes. Okay. All right. So I'm gonna have you feet outwards, inside, inversion. Okay. Eversion. Okay. Normal. I'm gonna have plantar flexions. You're gonna go like this and up on both. Okay. Plantar and dorsiflexion are normal. Okay. I'm gonna have I'm gonna lightly touch your lower extremities. You tell me if you feel it. Do you feel that?
Mm-hmm.
Okay, so I'm just looking for sensation of the lower extremities are intact. I'm gonna have you stand up. Okay, stand like that. Okay. All right, so I'm looking for any scoliosis. Okay, spine is, stand up straight. There you go. Spine is erect. Midline, there's no scoliosis noted. Okay, I'm gonna have you try to touch your toes as far as you can. Okay, good. Alright, now flex your back. Okay, perfect. Flexion and hyperflexions are intact. Okay, I'm just gonna go ahead and check for your hips. Okay, there's no swelling noted or anything. Is it tender to touch?
No.
Okay, not tender to touch. Okay, alright. I'm going to go ahead and have you walk from there to there. Okay, now come back to me. Okay, alright. So you can go ahead and sit back. I'll help you. Her gait was normal. Her gait was normal, and Romber's test was negative. All right, so this concludes my physical assessment. Thank you very much. Thank you very much for your time.